Well, good afternoon, everybody. Thank you, Eddie, for the kind introduction and for everything that you're doing to address social isolation and loneliness. I'm really grateful for the invitation to be here and the opportunity to speak with all of you this afternoon. And it is good to see my friend Congressman Patrick Kennedy here too. Thank you for all your work and leadership. Look, we're here today because of our concern about the loneliness epidemic sweeping our country. So I want to talk about why we've seen this alarming rise in loneliness and social isolation in America, the dangers it represents, and some of the ways that we can work together to address what is a mounting challenge. The America of 2024 should be, by many metrics, the most connected society in human history. With the internet and social media, we know details about each other's daily lives, interests, and politics that we may never have known before. Most of us are just a phone call, text, or email away from just about anyone in the country, if not the world. Yet in many cases, the very technological advances designed to bring us together have also created a virtual world that has isolated people from real human connections. Not so long ago, it was easier to forge social connections than it is today. Gone are the days where most people in any given community belong to the same bowling league, church group, or Rotary Club, where half the town belonged to the local American Legion. Of course, our country was always more complicated a place than what could be captured by the brushstrokes of Norman Rockwell. Depression and isolation have always existed. But across virtually all meaningful metrics, people today find it harder than they used to forge community. The increase in loneliness and social isolation presents significant tangible dangers. I don't need to remind you all here that loneliness can lead to depression, anxiety, and even thoughts of suicide. And it can lead to other drastic negative health consequences as well, increasing the risk of heart disease, stroke, and developing dementia. The Surgeon General has compared the health consequences of loneliness to smoking up to 15 cigarettes a day. The rise in loneliness and social isolation also presents a danger to our democracy. Our system of self-government depends on each of us, recognizing that while we may not agree on everything, as Americans, we're still part of the same team. We have to find ways to work together because our futures are inexorably linked. Feeling disconnected from one another, even fearing each other, strains the bonds of community needed to sustain a democracy. When people feel isolated, they also can become more inclined to spiral into extremism. They become prey to political leaders or forces that push misinformation or kindle resentments. And people of all ages and political stripes, behind the walls of the internet, find it easier to share extremist views, echo hate, and disparage their fellow Americans. So what can we do? The challenge of loneliness and isolation can't be overcome with any one law or perhaps even any set of laws. And we need to be realistic about the fact that loneliness is not something that the government can just wipe away. But there are areas where Congress can play a constructive role. While we are still figuring out what progress on this issue looks like, I'm encouraged by the bipartisan collaboration we've started to have. Democratic Senator Chris Murphy and Republican Governor Spencer Cox, for instance, have led the charge on ways to tackle loneliness head on. And I know that you'll hear later today from my friend and colleague, Democratic Senator Tina Smith, who's helped tear down stigma by sharing her own experience with depression, and who's led legislative efforts to address mental health and loneliness. I'm also working across the aisle on some measures that could start to help. For instance, I'm pushing for bipartisan legislation that's called the Improving Measurements for Loneliness and Isolation Act, which would standardize the definition of loneliness so that we can better study and understand its impacts, just as we do with any other health risks. And I'm working on legislation that would promote intergenerational care. For example, encouraging childcare and early learning programs to be placed at long-term care facilities for seniors, sparking connection between generations and bringing communities closer together. We've already seen the benefits of these programs in places all across the country, including in my home state of New Hampshire. And I'm sure that you'll hear more today about other bipartisan efforts to better support our youth in their communities, such as by strengthening mental health services for kids and protecting them from online bullying. The good news is that we've started to make progress on many of these fronts. For instance, the Bipartisan Safer Communities Act that was passed into law in 2022 provides many measures to support mental health. Earlier this month, I heard from people who are engaged in one of these efforts in New Hampshire. This is an effort funded by funding from the Bipartisan Safer Communities Act, and it's supporting a partnership in which the University of New Hampshire is training social work students. And while they are studying to become social workers on a school social work pathway, they're placed in Manchester schools to provide direct services to students. I think the number is going to be about 80 in the Manchester School District. So the bills that I just discussed, the funding from the Bipartisan Communities Safer Act, are ones with bipartisan support. And it's important to note that because, of course, we know that feelings of loneliness can affect people of any age or background, regardless of whether they vote red or blue. The efforts of everyone participating here today are just as important, if not more important, than what Congress is doing. If we're going to meet this crisis head on, each of us will have to do our part to combat loneliness. Because behind all of the statistics and figures that we're discussing today are people. People who may be your patients or your students, or may just be the person who you happen to see at the neighborhood coffee shop. It's the 20-something who moved to a new city who has no friends outside of work. The retired veteran who never married and spends most days alone in front of the television. The teenage girl who should feel optimistic about her future, but instead wonders if anyone would even care if she is gone. This country is supposed to be a place where everyone counts, where each and every person matters. That's the very definition of a democracy. It's also the essence of community. But we are not a community nor a democracy if we share a common land and a common distrust, but fail to develop a common bond or common purpose. And we can't be connected as humans if all we do through social media is know everything about each other except the very things that make knowing somebody worthwhile. Loneliness is not an easy challenge to discuss, nor is it an easy one to fix. But together, we can help save lives and ensure that in our country, everyone counts. So, a thank you to everyone here for your dedication to taking on this challenge to help your fellow Americans, humans, transcend loneliness and build relationships and community. I am really proud to be a partner with all of you in that effort. Thanks for your work.